Well, thank you so much for staying with us. 2024 in review, and of course, we're projecting, looking forward to the year ahead. The Honorable Minister of State for Health and Social Welfare joins us next for conversations around, of course, health and our social welfare. Because, hey, what are we going to do without health when we have all the wealth? Let's have conversations with him this one, and quite a number of things to discuss. The universal health coverage, a lot more people spend money out of pocket as opposed to, engage in the health insurance. This whole conversation around basic health care, primary health care that we've been hearing about for a while, mental health awareness policy. You hear a lot of people talking about their mental health now, as opposed to when so many people were growing up. Social intervention programs, social investment, all of that are packed in this conversation with the Minister of State for Health and Social Welfare, Dr. Iziaq Kunle Salako. He joins us from our Abuja studio. Thank you so much for joining us this morning. Beg your pardon, this evening.
Thank you very much, Ayo.
Yeah, and compliments of the season to you. Well, I mean, none of these issues are new to you. So many issues to look at. For you, as Minister of State for Health and Social Welfare, of all the issues that you have to contend with, which one stands out the most for you?
Thank you once again, and let me use this opportunity to wish all Nigerians a Happy New Year. Well, I think that generally the issues of health are complementary to each other. And most of the time, it is difficult to pick out one issue and concentrate on just that one issue. Because, for example, if you focus on primary health care, it is important. But you cannot do that without ensuring that the referral system to the secondary level and to the tertiary level is also strengthened and made seamless. So we have a situation where we must ensure that we manage the overall health system in the country rather than concentrating on one particular issue. But I can tell you that the bedrock of our health system is the primary health care. And that is receiving a lot of attention. But like I said, without the secondary healthcare level, without the tertiary healthcare level, we cannot have a robust healthcare system in the country. In fact, without the private sector, without the traditional practitioners, all of these are important to put in the basket of our health sector in the country.
Instructive that you mentioned the fact that primary healthcare is the bedrock. Very, very instructive indeed. But then there have been questions about how come it's the federal government that has to deal with primary healthcare issues when there are those who believe that that is supposed to be the purview of local government administrations?
Well, what the federal government does basically is facilitation. You know that there is the National Health Act, which creates a health system for Nigeria, and that health system coming from the primary level, the secondary level, the tertiary level, the primary care level, the private care level. The federal government as an institution is a coordinator of all of this. And at a lot of times, we also have to facilitate a lot of input at the primary care level. For example, when we are talking about the issue of universal health coverage, which you alluded to during the previous interview, you will see that without the federal government playing a very central role in coordination, in ensuring that resources are mobilized, the level of universal health coverage will continue to be lower than expected. So, whereas primarily the responsibility of primary health care falls within the ambit of the local government squarely, but at the federal level, we must coordinate, we must facilitate, we must ensure that we have a level of interoperation so that data that is generated at the local level are also aggregated at the national level to give a global picture of what is happening in the country.
So, Honorable Minister, recently we did hear about the multi-billion-dollar manufacturing facilities. I think 22 new healthcare manufacturing facilities. I would like for you to tell us about that and how that can help. I mean, I get excited when I hear about manufacturing Because when you talk to those, and I'm sure you've heard this even more than me, every single raw material they need to use for simple drugs have to be imported into the country, and that has fed into our medical inflation, especially with those multinationals that have left the country. So help us to understand how this is going to kind of calm the nerve or calm the expenses that individuals have to pay on some of those drugs that they have to take daily.
Well, that is a very important program of President Bola Ahmed Tinubu. You know that sometimes last year, the president brought on board the unlocking the value chain. And this was backed by an executive order to ensure that tariffs for some of the imports in the medical sector is eliminated or reduced. And because of that, and because of the focused attention of Mr. President to ensure that the healthcare system becomes a contributor to promotion of economic activities, direct economic activities, to a contributor to generation of employment. There's a deliberate approach by the federal government to ensure that we are able to help manufacturing industries that are coming in by creating a more enabling environment. And already that concentration, that emphasis, that deliberate policy is what is driving some of those manufacturing companies that you mentioned. And already we have signed MOU with quite a number of companies, including companies that are coming in to manufacture RDTs, rapid diagnostic tests, manufacture sonological equipment, manufacturing even drugs, and also raising input into the manufacturing sector. You also see that that deliberate policy is also targeted at promoting, because we procure a lot of pharmaceuticals, inputs, devices, consumables. So there's a deliberate policy to also support local manufacturers, so that whenever we're going to procure some of these devices, inputs into the medical sector, we deliberately target procurement from the local manufacturers. As an example, we have a local pharmaceutical company that used to manufacture antiretroviral drugs, but because government was not patronizing this company, they had to close the plant, the line for that manufacturing. But now that we are deliberately targeting local procurement, that company is now resuscitating that manufacturing line, and with the way things are going and the level of engagement that we have with that company, you will see us now procuring a lot of ARTs from our local manufacturers. Again, we talk about diagnostic equipment. We talked about long-lasting insecticidal nets. Some of these things are things we normally procure in large quantities, sometimes with support from our development partners. But because of deliberate policy of this government, to ensure that we have what we call a sector-wide approach to implementing our healthcare initiatives, our health sector initiative. Now, the developmental partners are in the same basket with us. We are all talking together. We have the same vision, the same direction, and we're ensuring that anything that we have the ability to do locally, they must patronize those local manufacturers. And that is generating a lot of interest among manufacturers. Even manufacturers that are not based in Nigeria are also taking a lot of interest in that. And that is what is resulting in those companies that we are hearing are moving into Nigeria to do manufacturing, to do assembly of their products, and to generally expand the quota of Nigeria generally in the health sector manufacturing.
Interesting, Honorable Minister, and I do like the fact that you have used the word deliberate like maybe 3 or 4 times, because, I mean, sometimes we just have policies and programs and all of that. So still following with that deliberate steps and intentionality that you say the government is now employing. What can we expect? I know you've mentioned the nets and all of that. Can we expect that perhaps we will have manufacturers who are Is it painkillers or some of those ingredients needed for painkillers? Can we have them maybe in the next 6 months? Or what really can we expect from these deliberate steps that the government is taking?
Well, first, I can assure you that the next set of antiretroviral drugs that Nigeria will be procuring, from the way we're moving, all things being equal, we will be procuring from a local manufacturer of ART. That discussion has gone very advanced, and I expect that all things being equal, we should be able to procure from a local manufacturer. Again, we are also looking at, within the next 1 or 2 years, we will start local manufacturing of malaria rapid diagnostic tests. The MOU has been signed. The discussion is robust, and we expect that in a very short, because some of these things are not very, very easy to totally predict, because they do not all 100% lie with government. For example, a manufacturer that is coming in, also we have to take into consideration some of the factors around that private player that may not be in total control of government. But our projection is that by 2027, our projection is that we should be able to expand largely the quota of Nigeria within the manufacturing sector in healthcare.
You know, Honorable Minister, this that you just mentioned now leads me to ask a question that we've asked quite a number of times, based on an issue that the Director General of NAFDAC had raised over time. And we've asked this question repeatedly and continually. So when we say that we're beginning to produce some of these things in country, it gladdens my heart. But there's something she's always talked about, and that's phytomedicine. That we have the potential to produce all of these things in Nigeria, in Africa, just the same way China has decided to focus on some of their own medical and health interventions, you know, in their own country. So, but the challenge that had been repeated over and over again by many people that we've spoken with in the health industry is the distance between the promises of phytomedicine and research-backed data to support the promises that it makes. What can you tell us about that? Is there any headway, any light at the end of any tunnel to activate our own phytomedicine, which a good number of people believe is a potential that we have in this part of the world?
Well, that is one area that I can tell you that even personally I am passionate about, because I strongly believe that we have our own resources within the phytomedicine enclave that can support the health agenda of Nigeria. And you see that within the unlocking value chain initiative that I spoke about earlier, phytomedicine promotion and development is occupying a very large part of it. And in this 2024, we have already developed a traditional medicine policy that we must be able to start the implementation in the new year. We have also compiled what we call the essential traditional medicinal formulary that's also captured at least a high proportion of the kind of phytomedicine resources that we have in Nigeria. Now, the gap that you mentioned has always been subjecting this phytomedicine to international acceptable standard of clinical trials that can create the confidence, that can make orthodox doctors prescribe those medicine, that can make us have confidence in the use of such medicine. We are therefore going to making a more robust plan with respect to conducting clinical trials. And one of the key areas that we're going to be doing in the new year is setting up a committee of, first let me also tell you that the alternative and complementary college that was created, I think about 20 years ago or more, which has not produced any graduate in the last 20 years, is going to be activated in 2025. Already we have appointed a sole administrator for that college, and we have secured a site for that college. We have already deploying staff for that college, so that we are not only talking about phytomedicine, we are standardizing it, and we are training practitioners who are able to also work within that confines and within that enclave to promote it. So I am saying that in the new year, you will see a lot of emphasis on how we can develop phytomedicine, subject them to internationally acceptable clinical trials that can enhance the confidence and put them on the shelf for use by our people.
So you said it's going to begin in the year 2025, and that's, it's gladdening to hear. But how far do you project that we'll be able to go in that regard? Because I'm sorry, a good number of people will say that when it comes to government, we hear of all these promises and we have a good start, but then after some time, it will seem like it just, tapers down. So what specifically should Nigerians look out for as the outcome of all of these wonderful initiatives you've mentioned in the year 2025?
Well, like I said, we already have a policy developed, and that policy is also we are going to now develop an implementation plan for that policy, and I expect that within the first or second quarter of 2025, we should be able to come out with that implementation plan that will set out clearly a robust pathway on achieving our agenda with respect to development of phytomedicine. But you know that this is a collaborative venture. We need to bring in the practitioners, the traditional practitioners, the alternative medicine practitioners. We need to bring in the researchers. We need to bring in even the pharmaceutical industry so that we all sit down and agree. It is not something that the Ministry of Health as an entity can just sit down and set agenda alone. It has to be a collaborative agenda setting. But now that we have a policy, the policy is a very important document that can be used for an implementation plan. But what I can tell you is that this government is passionate about phytomedicine development. And from what we are seeing with the Unlocking the Value Chain initiative of this government and the kind of response that we're gathering from the pharmaceutical industry, I believe that before the end of the tenure of this administration, we will see a leap forward with respect to development of phytomedicine in our country.
All right, so another issue, hot issue, well, not just in the health sector, but that affected the health sector is the JAPA. I mean, the departure of skilled professionals. It's no longer news. I wonder if there is a strategy to groom the new ones, because I spoke to someone in the sector a couple of weeks ago, and he told me, asked the question of who is even training the upcoming doctors and professionals in the health sector. It seems the strong hands have left. So even if we were to put our hope in the upcoming generation, those in school, the teaching hospitals, who's training them and who's going to take care of our health while we wait for them to get out of school?
Thank you very much. For us, what we call the Jack syndrome, the migration of professionals, particularly in the health sector outside the country, we see the negative and the positives. It is not all negative, because when people leave the country, it gives them the opportunity to acquire new skills, to acquire new experiences, to have broader interaction with the international health community. And some of them are able to also contribute to the development of our healthcare system using technology. Today, with telemedicine, a lot of things can get done even while you are not physically present. That is one positive aspect, we believe. And as a result of that, we have organized the Nigeria Health Professionals in Diaspora. And we have a committee sitting on that. And we have a regular interface with our diaspora professionals so that they can also, through telemedicine, through health missions, come back and contribute to the health sector in Nigeria. But beyond that, what we have also done is to ensure that we devise a scheme to ensure that, first, we are able to train more health professionals. We have expanded the level of the capacity of the production of health professionals. We're opening new medical colleges. We're opening new nursing schools so that when we increase the turnout of our health professionals, we can retain some, and those who want to migrate can also migrate, and we can also give them that opportunity to be able to contribute even as they migrate away. But the ultimate endpoint, that will make Nigerians stay is a gradual increase and a gradual improvement in our health system and our health infrastructure. So that, and that has started already. Because when you look at the level of, for example, in 2024, the level of investment that has gone into the health sector, both from the budgetary aspect and also from grants, from development partners, you will see that, like the president said, the health sector in Nigeria is clearly in the front burner of the Nigerian government agenda. And as a result of that, we expect that gradually over time, we can reverse not only the direction of health tourism or even the direction of the migration of professionals. But of course, like I said, this will take a while. It's not something that's going to happen overnight.
But Minister, are you saying there's nothing? Are you saying there's nothing to worry about who's training the future health professionals? Because that's also another worry. You know, that's also going on.
I am not saying that. But what I can tell you is that we have adequate resources for training. You know that medical training, health professionals training generally have what we call the regulatory authorities. And the regulatory authorities normally determine the quota, the infrastructure in terms of human resources, in terms of physical infrastructure, and except those minimum requirements are met, there will not be accreditation for the training of such institutions. So I assure you that at the moment, and going forward, we have quite a rich resource of people who are training our future health professionals. But again, I can also tell you that in this age of technology, in this age of digital technology, a lot of things is also getting done using technology. As an example, there's a platform now that has been created that we can use to even for continuous medical education for people who are already in service, and everybody can, 1 hour in a day, you can sit in your office, and everybody around the country can benefit from that without necessarily physically interfacing with the trainers.
All right.
So we're taking advantage of technology to ensure that not only are we training new healthcare professionals, we're also using technology to improve the skills, to improve the knowledge of even people who are already practicing.
Well, let's talk about mental health awareness, Honorable Minister. The Mental Health Act is active, and a good number of people are wondering whether there is anything happening actually, because sometimes some will go to hospital and be wondering if the person attending to them is okay. So in terms of the mental health policy and services, what steps would you want Nigerians to know that have been taken to operationalize the law and maybe even integrate mental health services into our primary health care?
Thank you very much. The Mental Health Act, the implementation has started. Already at the federal level, there's already a division being created to focus on mental health. The ultimate direction is to also create a department. And once we're able to do that at the federal level, we can also gradually dovetail it into the subnational level. Again, the mental health care system is also being integrated as an essential part of primary health care. And we're going to be training mental health technicians who can attend at that level to mental health issues. In the broader perspective of the non-communicable disease agenda of this administration, mental health is sitting very squarely within that, because we know that as we are battling with infectious diseases, we also must not leave out the non-communicable diseases like hypertension, like diabetes, like mental health issues that you have mentioned. So all these are being captured, and in the new year, we already instituted a program that's going to broadly also look at non-communicable diseases in a more elaborate manner, including mental health issues. So the implementation has started with a division at the federal ministry, and we're going to use that to dovetail to the subnational level and also the integration of mental health care into primary health care services. That is the
policy level, Honorable Minister.
Mental health more robustly. But of course, I must also
just
say
a second,
that
Honorable Minister. Maybe that's at the policy level. But on the streets, the stigma is still there. And even though mental health advocacy is gaining momentum, stigma is still an issue. So is there a role for government in creating awareness, campaigns and partnerships so that we can cut down on stigma and people dealing with mental health issues can actually come out? The truth is, and I'm sure you know, those who have mental health issues sometimes don't even know that they have mental health. Acute anxiety, for instance, is a mental health issue. But many people don't even know it's like that. But the stigma, once you say you want to go see a mental health person, the stigma is there. You understand that. So is there a plan to deal with that decisively?
Well, you actually interrupted me. I was just going to go there because one of the key agenda of this government is first to look at our psychiatry, what we used to know as our psychiatric hospitals. Because the moment you go, just like you said, the moment you say you are going to a psychiatric hospital, people believe that you have mental health issues. So we're refocusing the way the psychiatric hospitals are perceived. First by changing the names from psychiatric hospitals to specialist hospitals. So that one, you are not stigmatized, you are not labeled when you go to psychiatric hospitals. That is one policy level decision that is going to be taken in the new year so that that stigma is addressed from that angle. But of course, like you have said, awareness is very, very important. But I know, you know that culturally, the way we look at mental ill people is like people who should not be tolerated within the society. And awareness creation, changing our perception is something that's very important. That, of course, is a across society approach. As media, you have a responsibility. As Ministry of Health, we have a responsibility. As individuals, we are subnational government, we have a responsibility to create that awareness, to create that change, the paradigm shift, to be able to treat mental ill people with more level of accommodation, with more regard, with more level of consideration, you know. So that is an ongoing process. Of course, the federal government will play its role in terms of creating awareness, in terms of partnering with the media, in terms of partnering with NGOs, but clearly at the policy level, such are some of those things that we are doing to ensure that we put a lot more emphasis and highlight the challenge around mental health in our country.
All right, Honorable Minister, one of the indices used to, differentiate a developing country from a developed one is, access to health care. And we know that out-of-pocket payment is a major one in Nigeria, and that has, reduced our status. And when it comes to that, we've heard of different types of insurance, health insurance programs. I know that here in Lagos State, there's the Ilera Eco, which obviously I think covers mostly the government workers. Is there a way to simplify this financially and otherwise for a lot of Nigerians not to have to do out-of-pocket payments for their health care? Because, a lot of people are reluctant to go to the hospital when they know they don't have the cash.
Well, if you look at the agenda of Mr. President that he used to campaign, the Renew Hope agenda, one of the key elements of healthcare sector mentioned in that document is that health is treated as a human right and a matter of urgency. And if you also look at the presidential priorities of President Bola Ahmed Tinubu, you will see health as being taken as a promoter of productivity, a promoter of economic activities, a driver, an enabler of even economic development and poverty eradication. And against that background, you will see that the universal health coverage agenda of Nigeria is sitting very, very prominently within the pillars of the Renew Health Sector Investment Initiative. You see that when we talk about efficient, equitable, accessible, and qualitative healthcare, which is the second pillar of our initiative to drive the health agenda of Mr. President. So within that ambit, universal health coverage is a major and important element. And in the last 1 year, for example, I can tell you that through the program that we have initiated using the Basic Healthcare Provision Fund, additional about 2.5 million Nigerians have been added to insurance coverage. That may look small to you, but if you consider that in about 24 years since the establishment of the National Health Insurance Scheme in 1999, we were only able to cover about 16 million people. And in 1 year, we have added additional 2.5 million or thereabout to it. And that is focusing essentially on the less privileged, the vulnerable people, using the Basic Healthcare Provision Fund, which provides some sort of financing to identify primary health care, like about 8,000 of them across the country, to be able to procure drugs, provide inputs into healthcare services, logistics, and so on and so forth.
All right.
So gradually, we're seeing a situation where, over time, we can gradually increase the level of coverage of the insurance scheme, the social insurance scheme especially.
All right.
Like, again, this is not going to happen overnight. Because
all right, Honorable Minister, we're really out of time. Thank you so much. And I mean, as you would expect, we do hope to see, maybe faster coverage. Then we would feel it more. But thank you so much for your work and for sharing this time with us. Minister of State for Health and Social Welfare, Dr. Iziaq Salako. Thank you.
Yeah,
now, let's take a break now. When we come back,